Bismillah Rahman Rahim. This is another group of antibiotic which is called aminoglycosides. Aminoglycoside, this is another group of antibiotic. We can say this is broad spectrum antibiotic having strong bactericidal activity. So, aminoglycoside, this is the group of antibiotic which have the capability to stop the growth of microorganism as well as to kill it or destroy it completely. The spores which can kill the wide range of microorganism. So look at here, these are the indications of the aminoglycosides. So aminoglycoside, they are used in the treatment of endocarditis. If a patient is suffering from endocarditis, inflammation and the malaria of the heart, like pneumonia, meningitis and septicemia. So these are the drugs which are used in the treatment of variety of infections, as I have mentioned, as I have discussed in the previous lectures. The basic mechanism of action or mode of action of aminoglycoside, these are the drugs which are responsible to inhibit the bacterial protein synthesis. But these drugs, they are not safe in pregnancy. It cannot be recommended to those candidates, to those patients to those female who are pregnant. So it cannot be recommended, aminoglycoside. Now, what are the group members of aminoglycosides? So aminoglycosides, there are certain agents. For example, gentamicin, it belongs to aminoglycosides, amikacin sulfate and streptomycin, neomycin and tobramycin. So you can't use it, and so these drugs, they are not safe in pregnancy. And these are the group member. These are the categorical classification of aminoglycoside. So these are the classical example of aminoglycosides. Now look at here: gentamicin, amikacin sulfate, streptomycin, neomycin and tobramycin. Now these are the various side effects which are reported after administration of aminoglycosides. Nephrotoxicity is the major side effect which is reported after administration of aminoglycosides. Nephrotoxicity means when blood, urea, nitrogen and serum creatinine level it become high, and there may be chances of ototoxicity which causes dizziness, tinnitus, loss of balance, hair loss, neuromuscular toxicity, muscle tremor or twitching, so decrease muscle strength. These are the various side effects which are reported after administration of this drug. Now there are different routes of drug administration. So it can be administered intramuscularly or intravenously. So polar compound, they are not absorbed by taken orally. So usually those compounds which are polar in nature, they are not absorbed orally, but they can be easily absorbed intravenously, or if these four compounds, if they are in the form of injection, so it can be easily absorbed in the blood circulations. Now look at here. This is the nursing care, which is very mandatory. So in nursing care, administer gentamicin cautiously in clients with impaired renal function and reducing hearing, dehydration and neuromuscular disorder. So all these parameters can be checked. After that, you can recommend it, the drug according to the according to the proper protocols, through which you can also monitor for the dizziness and ringing in ears, monitor hearing and balance. You can also check and monitor the renal function test and take output, especially serum creatinine and BU and blood urea and nitrogen. Adequate hydration is also very important. There must be some fluid in the body of that patient. Antibiotic nursing implication before beginning therapy, assessing drug allergy, hepatic and narcotic function and lab studies obtained through patient health history, immune status, especially in case of recurrent infection, it should be reported. Assess for contraindication to use antibiotic and potential drug-drug interaction, which is also very mandatory. And